Hi guys, Ariana here at the AEFE Training Center, and I am going to walk you through kind of a difficult patient for me, not because she has unrealistic expectations or because I can't necessarily do anything on her, more so because her tissue is really thick and she wants a snatched jawline. Now, patients like her, it's a little bit harder just given the fact that that's a lot of tissue to kind of pull back with a thread or a lot of filler it's going to take to show some definition when they have a little bit of thicker tissue. With that being said, we opted for a filler treatment on top of neck threads. We have previously done filler treatments in her jawline and her chin. We were hoping to try to just keep working, and I told her it was going to take a while to build up that jawline and that she's got to give me a year and be patient. With that being said, she was interested in trying threads for the first time at this appointment, so we opted for doing 2 neck threads bilaterally to try to snatch the jawline kind of from a different angle while continuing to work on that gonial angle in the back of ramus filler injection points. Now for her as well, I am doing the very best that I can, but also letting her know that the best results are going to come with time. Granted, I will get instant results with PDO thread lifts, of course, but I'm not necessarily going to get the full results, and I also need to be really patient with it. With that being said, she's the perfect patient for this in the sense that she's really good with post-care, she's really good with bruising and swelling and communicating, so I have no concerns with her about trying threads and filler at the same time. So just kind of moving along, I worked on marking her up when she was sitting upright always, just so I know what I want it to look like, how to pull. It's interesting seeing the patient from this angle because you never know if they're closing their eyes or keeping them open. So it's interesting that her eyes were open this whole time. But you can see she's not even moving. She was very comfortable. I numbed the porthole and then I created the porthole with an 18 gauge. And here I am just going in making the track that I want with lidocaine. This is 1 or 2% lidocaine. I don't give epinephrine in this just because I don't like my patients to feel jittery, and there's genuinely just not much of a need for it. With that being said, when I numb just the porthole though, I do give lido and epi to try to vasoconstrict, and it's not a ton, so it shouldn't make them feel too jittery. So here I am just numbing both tracks. Some providers only do 1 track for numbing. I just prefer my patients to be as comfortable as possible, and I numb both tracks. Now, that's definitely not necessary, but it's a cheat sheet for me because I'm creating the track and making my life easier, but I'm also making her comfortable in the process. So I think it's a win-win, but again, that's completely up to you as the provider. Now, here I am. It's so much easier to go in with those PDO threads because I already created the tract. But you guys can see, her tissue is very, very heavy, which she'll have a great lift, and I could also use a thicker thread itself for this reason. But it's a little bit tougher to kind of create a jawline on a patient like this. Now, with that being said, patients' open communication is going to be huge. Knowing that she's not going to get the results that she wants overnight is very, very important to tell your patients. Now, with that being said, I did put the first one in. Some patients might require 1, some might require 3, maybe even 4 bilaterally. It just depends what you want as the provider. But I have had really great luck just using 2 bilaterally, and I will have them come back in 2 to 4 weeks and just check everything, see if I need to pop another one in. This patient's funny though, because we were supposed to do microneedling this day, and we actually clearly opted against doing microneedling because she had a wedding the next day, but she was way more interested in getting neck threads and jawline filler and being swollen that way. She just really did not want to be read from microneedling, which I just thought was really funny. Now, with that being said, I'm pulling the threads themselves taut to try to engage them, release them, and then I will keep this site very, very clean. I'll put Band-Aids on for her, trim, clean with alcohol one more time, just because a huge concern with threads being a foreign substance is infection concern. So I do like to keep that area very clean with alcohol right before I put a Band-Aid on. And it'll make that Band-Aid stick a little bit better too. So very happy with her results. one side versus the other, and she was as well. And obviously this was pre-filler too. So we teach this in PDO too. Take our course and I'll see you guys there.